Hello, everyone. I'm here with Dr. Jui Haker. He is a doctor in occupational medicine. How are you doing here, Dr. Haker?
I'm doing very well, thank you.
And yeah, let's get straight into the questions. What would you say are some reasons that you really got into the medical field?
So I think the biggest inspiration was a family member who I respected, looked up to, and she was a physician. And I was impressed with what she was doing, helping patients, helping people. And I was always interested in the biological sciences, so that's what got me interested.
And after you got into the medical field, what really pushed you to go into occupational medicine?
So occupational medicine is big here in the United States. So when I was in India, I did preventive medicine, public health, and
Mhm.
that is more hands-on care with patients in underserved populations, with, of course, a focus on preventive health. Um, and when I came to the US, there is definitely a field of preventive medicine and public health, but that is not so much hands-on patient care. It is more about policy and strategies, etc., from a public health perspective. And I did not want to give up the actual hands-on patient care, but I still wanted to focus on preventive medicine. And so that is why I decided to go into occupational medicine. Occupational medicine is one branch of preventive medicine.
Right.
General preventive medicine is a larger umbrella under which comes occupational medicine and aerospace medicine as well.
Mm-hmm. And what would you say are some key skills that you need to have to be successful in occupational medicine, in specific your field?
So I don't know. I mean, the key skills there is a lot of there is a lot of I mean, you obviously get training during residency, but um, you have to, as an occupational medicine physician, you have to understand your role. So you are trying to make it sound simplistic, it is making sure that you are fitting the right person to the right job, making sure the person is a good fit for the job and the job is not going to impact this person's health in any way.
Mm-hmm.
Um, so we are not primary care doctors. We don't have this ongoing relationship with the patients. Um, and we both help the patients as well as the employers. So I think keeping that in mind and being able to navigate that is really important. And you also have to have a liking for understanding, um, the various state laws surrounding workers' compensation or work injuries and things like that. So
Mm-hmm.
um, not everybody enjoys it,
Right.
you know, because so many people, they really like the ongoing contact that they have with patients on a regular annual basis. And you don't necessarily get that in occupational medicine.
Mm-hmm. What are some ways that, yeah, as you were talking about, you have to help both the patient and the employer which the
Mhm.
patient works for. So could you give us some examples or ways which you have helped the patient and the employer?
So, I mean, big thing that we do is workers' compensation injury. So we are making sure that the we are able to heal the patient, help them get better from the injury. And a big part of that is making sure they have appropriate work restrictions so that when they go back to work, they get eased into whatever work activities they are responsible for. And they are not thrown back into the work before they are ready for that. So
Mm-hmm.
having the ongoing discussion with the employer, the supervisor of the patient, saying, okay, what jobs are available for this guy if he's on these restrictions? How can we help him? Can you provide these accommodations, etc.? And
Right.
then making sure that we are providing the proper treatment to the patient as well at the same time.
Hmm. And what if, suppose if somebody has like a leg injury, but that specific company does not give like specific jobs where like you can sit down and do, what happens in those scenarios?
In those scenarios, typically then the patient would not be able to go back to work until they are completely better. Um, and that's unfortunate because it's not good for the patient also to be completely off of work. Being back into the work environment always helps them get back to their regular job sooner.
Hmm.
But not everybody can accommodate that, and we understand that. But we would never send somebody back sooner
Then they have to.
unless they have recovered from the injury.
Right, right. And as you mentioned, you had been in India before, you had come and done your
Mhm.
studies in the US. And while you were in India, you had gone to SET Medical College for your medical school and then transferred to the other college for your residency.
Mhm.
So, what would you say some key differences are in your experiences which you had in medical school and then in residency, than the obvious part where you were learning more in residency than in.
Yeah, right. I
Mm-hmm,
mean, in medical school, of course, you're basically just learning. I mean, you do a lot of hands-on stuff as well. But in
mm-hmm,
India, it is different because you are not just in medical school. Before you get your degree, you have to complete 1 year of uh, residency, which is called internship. So in India, you have to complete your internship year before you are granted the MBBS degree.
mm-hmm,
In the US, you complete 4 years of medical school, and as part of those 4 years, you do some rotations, clinical rotations.
mm-hmm,
But your internship, where you are actually taking care of patients, you are the person responsible for taking care of the patients.
mm-hmm,
That is part of your residency. That's not part of your medical school training.
mm-hmm.
I think that was one big difference, of course. And then, of course, the fact that there's a big reliance on electronic medical systems.
Right.
Over here, navigating the health insurance fields in this country, that wasn't something we had to deal with back in India.
Yeah.
Well, now it might have changed, but at least back then it wasn't the case.
Yeah, yeah, that is true. And what would you say, some ex what do you, how would you say your experiences in your internship here in India have helped you throughout your career till this day?
Internship experiences in India.
Mm-hmm.
I think one of the biggest thing is the ability to work in all settings. In India, as part of the internship, especially at the college where I studied, um, you got sent to these underserved populations where um, you have to you have to provide proper health services with limited resources. And being able to do that is, it's really a skill. You don't have all these fancy
Gadgets.
technologies, the laboratory services or imaging services, everything that is
Mm-hmm.
so easily accessible in the clinics and hospitals here is not necessarily available. So you really have to think about, okay, does this person really need to be seen in a higher facility? Because that means I'm going to have to convince this person to take time off from their work, which means they are going to lose
Some more
a
money.
day's job so that they can go and get taken care of, get these additional tests. So um, I think it puts a lot of things in perspective.
Mm-hmm.
You end up doing a lot of reliance on your clinical skills, etc., which of course you do even here, but you have the additional benefit of having other things available at your fingertips over here.
Right. And you don't really need to can't really take the patient unless it's absolutely necessary, and you have to convince them after that the fact.
Exactly.
And so like once you really like stepped into the internship and after you finished your internship year, how would you say your expectations differed from what actually happened? So like in the sense like what did you expect when you came into it versus what was actually the case? What are some things that really stood out, surprised you?
Well, I think one of the biggest things that surprised me is about health insurance. I mean, I always knew that, we would have to deal with the health insurance, but the amount of technical stuff that you have to learn, you have to learn these electronic medical record system.
Mm-hmm.
You have to keep up with those updates, and you have to learn how to navigate with health insurance systems. And
Mm-hmm.
it's these nuances. It's not enough to just know,
Right.
okay, this is the ailment, this is how I treat it. You have to make sure that you know the ailment, you know the treatment, but you have to also be able to convince the health insurance agency so that they cover those services, because otherwise you're going to have patients with out of pocket expenses, which, as you know, in the United States can be horrendous.
Right.
And then you have patients that are, either upset with you or not able to pay those bills, etc., etc. So
Mm-hmm. And what would you say are some skills which you can only learn after years of experience? I feel like one of the skills you have mentioned, which you have learned over the course of the years, is communicating with health insurance companies on how much the patient needs to pay or what's happening. On addition to that, what are some other things that you have learned over the years?
yeah, I mean, it's hard to explain some things that come with experience. Like, I know there are certain things that, the more you see patients, the more you see the same types of cases, or what has worked in the past. Like, for example, in my field especially, um, I know what kind of work restrictions I can write and still be able to help the patient. I know, uh, especially if you are in one area, you know which companies you are dealing with, what kind of uh, which companies will be willing to accommodate restrictions versus which won't be. So,
Mm-hmm.
and that's not something, or that's not something that anybody can even
Teach you.
teach you, because it's hard to
You can't really
put
judge
that
it.
in writing.
Right, right.
It's something that you learn over the course of years. I mean, you just have to remember to ask a lot of questions. You have to reach out to um, either colleagues that have been here, and I don't just mean other physicians. I mean, you have to rely on all your other ancillary staff who might have been here longer and might know whom to contact. So
Mm-hmm.
I'm always, talking with my RNs, my medical assistants, and of course my other physician colleagues also.
Mm-hmm. And could you give us a real example where you have given a remediation for a patient and then walk me through the process of how you contacted insurance companies and what the end result was of that?
Yeah, so I mean, usually most places, most clinics over here will have medical staff. So either your medical assistant or a person specifically dedicated to, making the initial contact with the insurance company. So
Mm-hmm.
many a times, like if we have to say order uh, a specific test that is otherwise really expensive. Uh, we know by now which tests are expensive, and if we don't get prior approval from the insurance company, then it's going to be hard for the patient, because otherwise they will be stuck with a bill.
Right.
So we make sure that when these tests are placed, we find out who the insurance carrier is for that particular injury, and
Mm-hmm.
we reach out to the case manager over there. Usually it's either my medical assistant or my nurse who does that,
Mm-hmm.
and talks about the whole scenario. If they need more, have more questions, then they may transfer that to me. They may send me additional paperwork to fill out, just to justify that this is necessary. And then once it is approved, then we know that yes, insurance will cover this particular
Mm-hmm.
uh,
It is whatever, like the injury.
exactly whatever it is that is being ordered. So
Mm-hmm. And so how would you say a day in life look like? Like really walk me through what happens from when you set foot in the office to when you leave.
yeah, so on a day when I'm doing just clinical work, for example, I start my schedule at 7:30 in the morning. So that's when my first patient is scheduled.
Mm-hmm.
And so Patients, I may be seeing patients either every 15 minutes or every half an hour, depending on the type of visit. And usually they are all scheduled beforehand. So in our department, they are scheduled beforehand.
Mm-hmm.
If you are in a different field like urgent care or emergency medicine, it's all whatever comes in the door.
Right, right.
So, um, and depending on your personality, you may like certain things. Like there are some people who really like the challenge of, oh, this is, it's going to be an exciting day. I am going to be able to treat whatever comes my way today. And but there are others who are really they really enjoy a schedule. They want to know ahead of time exactly what is required or exactly what they are going to face. And so um,
Mm-hmm.
some of that mindset is also important in deciding what field you go into. Um, so usually it's my medical assistant who is going to be rooming the patients, and we have protocols on what all we need to do for each patient.
Mm-hmm.
Um, when my medical assistant goes in, does everything that needs to be done, she hands me the paperwork, and then I go and finish the visit, get the history, physical exam, um, put in the orders if necessary, etc.,
Mm-hmm.
and then send the patient to the other department, wherever is it, whether it's the lab or imaging,
Right.
wherever they need to go next.
Mm-hmm.
And then we have to wait for those results to come back. Once the results are back, we have to contact the patient and say, okay, these were your results, or we have to have them come back in to discuss their results. And sometimes we may have to refer them to a different specialty for further treatment.
Mm-hmm.
And so that's basically what happens with each patient. And so because ours is a clinic-based department, we don't see patients in the hospital, and we don't deal with emergencies. We have a set schedule.
Right.
But that's not necessarily the case in other fields. So if you are a
But
primary care physician or if you work in the hospital,
right.
your hours may vary.
Mm-hmm.
Uh, and so usually then I'm in the clinic 7:30 to 5-ish.
Mm-hmm. And then yeah. So as you said, you have like a set time period of 7:30 to 5 p.m. So
Mhm.
how would you say your work-life balance looks like? Meaning like does your work carry over when you get home, or is it like after five o'clock, whatever you're finished, once you're done with something?
Sometimes, sometimes it does.
Mm-hmm.
Usually we are supposed to document all patient encounters. So the patients are on the schedule
Mm-hmm.
in whatever electronic medical record system you use.
Right.
And once the patient checks in, they arrive the patient. And when they arrive the patient, it basically means you have to open up that encounter and document everything that you did for
Mm-hmm.
that patient and then close out the encounter, because that's how the billing gets done.
Right, right.
Um, so sometimes if it's a busy day, and it's not just the patients on the schedule, sometimes prior patients may be calling with questions. People may drop off other things that we have requested that I have to review. So
Mm-hmm.
there are a lot of other in between things that happen. And if it's a especially busy day with patients, then I may not finish writing all the notes.
Right, right.
So, sometimes I do have to take it home, but more often than not, I'm able to finish things in the clinic. So I
Mm-hmm.
think in our field, it's unusual to have to take your work home.
Mm-hmm.
Not that it never happens. And of course, if you are super efficient, you'll never have to take it home. But
It just depends
if
on the
you
day.
are, mm, if you're not efficient, then no matter how few, whatever few number of patients, you'll still end up taking it home. So
Right. It all depends on how you really working.
exactly. And I think you have to develop a system for yourself to make sure you are putting in proper documentation,
Mm-hmm.
but you don't necessarily have to write a thesis for every patient. And so finding that right balance will, of course, again, come more you practice, the more you'll get used to it.
Right, right. And I'm guessing organization is a pretty key skill to have.
Absolutely.
And over this past year or so, COVID-19 has hit all across the world. So how would you say your line of work, how have your clinic especially been affected by it?
So it was, I mean, it was mainly affected during the first 3 months when everything was shut down. Um, and at that time, they were recommending us to see patients only in cases of, only for emergencies. We
Mm-hmm.
should be seeing them in person. Otherwise, they were encouraging face-to-face, I mean, telehealth visits, not face-to-face visits.
Mm-hmm.
Uh, so the first few months were slow, uh,
Mm-hmm.
but then back in June, July, things started picking back up because as businesses started opening,
The more
we had to
hospitals.
start seeing more patients. Exactly.
Right.
And of course, there's always precautions being taken. So we are wearing a mask and a face shield with every encounter. Patients are screened at the
Entrance.
door of the clinic.
Mm-hmm.
If they have any symptoms, then they have to first get tested before they come to the clinic because there are specific clinic locations that are designated as uh, the sites to swab for COVID-19.
Mm-hmm.
Uh, and they try to limit it to those areas so that you're not transmitting the infection everywhere.
Right, right.
And I think the clinic has done a very good job of that.
Mm-hmm. And you were talking about how you used telehealth at the beginning, like April, May, and
Mm.
whatnot of the pandemic. So, do you think telehealth is a viable option in the future to start using it, or is it just like right now you had to use it and it was kind of a had to do basis?
So it depends on the department. So in our department, we didn't find much use for telehealth because there's a lot of legal aspects related to what we do in our health.
Mm-hmm.
And so you have to document whatever you are doing. So you have to lay hands on the patient to listen to their heart, listen to their lungs, etc., etc.
Right.
Um, so it was very difficult for us to do. We didn't do a lot of telehealth, so we were especially slow.
Mm-hmm.
But for other departments, primary care, for example, or maybe even psychiatry, um, there are definitely certain conditions where it's.
You kind of
I
had
think I
to.
used to see telehealth as probably being an option in the future because um, it's so convenient for patients. Like if I were a patient and I had a minor symptom, it's not minor enough that I could ignore it. I wanted to get it checked out, but I didn't necessarily want to leave work and drive over to the clinic, wait for 2 hours, etc., etc., etc.
Mm-hmm.
So um, the telehealth is a great option because I can keep working right until it's time for my appointment, then log in, have my visit with my doctor, and
And
then get back to work. And all this extra way, sitting in the waiting room,
it cuts down,
driving time, all that gets
cut down.
eliminated. But of
Mm-hmm.
course, it's not possible all the time, but
Sometimes.
certain conditions, exactly,
Right.
definitely.
And that's always helpful. Well, like if you have a small cough or like a runny nose, like you can just check in.
Exactly.
Like, oh, is this anything bad? And it's like, no, okay, good. I can go back to my
Right.
work. A-
Yeah.
And does your clinic offer any remote opportunities for high school students, like internships, research opportunities, etc.?
Unfortunately, no. So we are not an academic center.
Mm-hmm.
Um, it's a it's a private
Private hold. Mm-hmm.
private practice, private groups. So we're not affiliated with students or residencies,
Mm-hmm.
etc. Now I know sometimes people who are in a residency program, like here at UW Health, they may come and shadow us for a few
Weeks.
weeks,
Mm-hmm.
but that's not, um,
Right.
at least in our department, it's not something that happens often.
Mm-hmm.
I
And
know they don't have much for high school students, though, unfortunately.
mm-hmm. And speaking of high school students, how can high school students gain more knowledge in your line of work?
So I have to say, like in the field of medicine, occupational medicine is um, not a whole lot of people have heard of it, and so it's very, very specific and it's a
Detailed.
smaller program.
Mm-hmm.
Um, So most people who get into medical school have some experience with either internal medicine or family medicine, primary care kind of stuff.
Mm-hmm.
And you may gain experience, you may come in contact with it
But
later down the line. But I think as a high school student, I would encourage that you first try to get into some
other
uh,
kind of.
field in primary care, or like a general practitioner, family doctor, to try and really understand what it is to deal with, one-on-one deal with patients.
Mm-hmm.
And I think that is having that good solid foundation is important. Um,
Mm-hmm.
and then you can branch off into whatever specialized field
You want to
you
be
want.
in. Right. And how would you say, which way is occupational medicine going in today's world? Do you believe that there should be more offices, more clinics in which occupational medicine is being practiced, or do you think there's enough right now?
Well, I know that there is always a need, but the residency programs are smaller. Uh,
Right.
um, so I think as long as it stays stable, maybe, it's growing definitely,
Mm-hmm.
uh, but the need of the general population is always primary care is where it's needed the most.
Right, right.
You need more primary care physicians.
Mm-hmm.
Uh, with occupational medicine, yes, I mean there is definitely a market for that. Uh,
But just much smaller compared to.
it's much smaller, exactly.
Mm-hmm.
Eh,
It
It's,
just happens to be
if you
small.
have a solid base in primary care and then you go into occupational medicine,
Then
you
it's
know, you're
easier.
probably at a bigger advantage.
Mm-hmm.
Uh,
Right, right. And why do you believe that occupational medicine is important in today's world?
Again, especially, you have to make sure that people are physically able to do the jobs. Uh, you never want to be in a situation where they have a health condition that they are unable to do the job that they are supposed to do, or that the job will make their health worse. Um,
Right,
and you have to, I think, all patients, like not everybody can speak up for themselves. There are some employees that um, they're afraid to speak up for fear of losing their job, but they still need an advocate to
really help
make
them.
sure that, exactly.
Mm-hmm.
And then on the flip side, you want to also make sure that whatever policies the company is following is adequate to protect their employees. So you are advising both the employee and the employer
Mm-hmm.
to make the decision that is best for both of them.
And one final question for today. Where do you most see your patients from? From like which industry do you see your most patients coming in from?
It's all over. It's all over. So, I see firefighters, I see police officers, truck drivers, I see factory workers.
Mm-hmm.
So
It's-
it's all over.
and
Yeah.
yeah,
And like any employer you take,
there's some injury
they're
though. Mm.
exactly. I mean, it's not just injuries. Some of them may send them for what they call a pre-placement physical, which means they want a medical professional to evaluate the person to make sure that they are being hired for the right job, and if they need any accommodations because of a health condition,
Mm-hmm.
then we have to let the employer know ahead of time that yes, this person needs accommodation. So
Right.
uh, a lot of employers are going that route where they want to make sure that their employees are safe to do the job.
Mm-hmm. And yeah, those are the questions I have for you today. Thank you so much for coming and sitting down with me, Dr. Haker. If you want to ask any questions to her, just leave my email down below. Just email me and I can ask them for you. And yeah, bye.